Back live with you tonight here on In Focus. The question we're asking you tonight, what is weakening our food safety and strong food systems in the province? Your view tonight, 072-110-5584. You can drop us your views, otherwise on X at Newzroom405. This as the Gauteng province is experiencing an increase in food poisoning cases with over 200 incidents and 10 fatalities since the beginning of February 2024. The Provincial Health Department says most of these cases were reported in the Ekurhuleni area and involved children. Head of the Gauteng Food Safety Forum, Christina Moumakwe, joins us for more on that. Good to have you and thank you very much for your time.
Good evening, viewers at home, and good evening, Thabo.
The numbers that we are looking at, I think, are in line, I suppose, with the World Health Organization statistics of how this actually happened. 1 in 10 people in the world fall ill after eating contaminated food, and the burden of foodborne diseases are actually sitting on children under the age of 5, which carry 40% of the burden. 125,000 of them die every year. We're looking at alarming numbers here in South Africa. So, which says access to sufficient amounts of safe and nutritious food is becoming an issue.
It is, but not really. Yes, it is an issue because nowadays it's easy to do quick meals. People prefer normally to go and buy food instead of preparing food at home, which also poses a risk because during the preparation at home, you can be able to monitor the food instead of just going to next door or just in a spaza shops or around just to buy food.
And what is the degree of collaboration between government, producers of food, and consumers who are needing help, of course, ensuring that they get safe food?
Currently, the Department of Agriculture is working with us, which also assists that to promote farming. Yeah. Because we've got a new concept to say each and every household must have a vegetable garden, which also assists with the reduction of costs on buying vegetables, and at the same time, the issue of uplifting poverty. As a Department of Health, we have introduced a new setting where we want one facility with one garden, which assists with vegetables for the community within the area.
Okay. And what are the type of bacteria that we're dealing with here? You've got salmonella, you've got listeria, you've got cholera. What are these children suffering from?
Normally, we find that we find salmonella in these food products. But just maybe to highlight some few things, the 10 cases that have passed on, some of them we've identified that it's not just foodborne, but it might be some chemical or pesticides or some source of contamination. It's just when it's reported to the department, it reflects as foodborne illnesses. But during the investigation, as well as investigation, we find that there is an issue of an element of retex, an element of organophosphate that is also reflecting. We have seen some of the kids in Ekurhuleni where there was retex found in chips that they consumed. So it's not just foodborne alone, but there are contributing factors. Yeah,
somebody can look at that and say, well, government should make food safer. It's your responsibility, or you play a pivotal role of regulating that particular space. You come up with frameworks, you establish how you're going to effectively police those and make sure that the food that people consume is safe. But not only that, the handlers of the food and those who produce the food are severely punished if that is not done.
We have already started with food safety blitz, where we are working with Department of Agriculture. We are working with the police just to ensure that whatever chemicals that is being used in the household, because we might be using Doom, but in the next, in the long run, we will definitely be affected. So which is also contributing, but we are having awarenesses which did not really start now in February. We have implemented a TISH which is Township, Informal Settlement and Hostel, where it's running in our communities. We are doing awarenesses. Now we've already introduced a corner to corner, where we want the community to be aware of mpox, of foodborne illnesses, of chemical safety, because the issue is about handling of food that becomes contaminated.
Right. And what are the key areas of education that would actually tackle in terms of the age groups, the demographic, where it's happening, areas, location, and so on and so forth?
So where we are now is we have seen that most of the cases are in Ekurhuleni. The phosphorus area is tomorrow. We will be collaborating with Department of Education, because we don't just feel like these kids are just consuming food, but Department of Education plays a major role, and parents within the society. So we are starting tomorrow, and also around Soshanguve areas. Those are our hotspot areas, but we are focusing the whole province. But our starting point is this too. That's why we'll be doing a mass campaign on safety practices, on proper handling of food, transportation, preparation, and also storage of food.
On 4 occasions, if my memory serves me well, if not more, here in the Gauteng province, when we've had to speak with the Department of Education, we were dealing with foodstuffs that they buy at the tuck shop or they sell, are sold by the informal traders, which it's reported that the children would have engaged in that. So how much assessment is being done on the microbiological, on the chemical hazards that are contained in some of these products that are being sold to the kids?
Okay, for each and every foodborne illness that has been identified or reported to us, we are taking biological samples to the infection prevention control lab, where we are doing the biological analysis, detecting any contaminants. Then at the same product, when we suspect something which might be related to chemical safety, we've got a laboratory in Pretoria that is also doing an analysis. But for the kids that have passed on, we also do a post-mortem. So we are able to link the 3 results. Then we'll be able to conclude and say, this might be the source. But we have seen that some of the clinicians, as they report in the facilities, if they suspect organophosphate or any chemical, they're able to determine that as early as possible.
Yeah, because I mean, people just immediately take that and they assume that no, it's informal traders. They're selling expired foods, and government is not doing anything. They're allowing this kind of stuff to come into this country because the controls in your system are weak.
No, we are working. We are working with all different stakeholders. It's just that as health alone, we are not going to win this battle. But we are working with different stakeholders. We are working with consumer protection, which also assists us, agriculture, and we are monitoring these tuck shops on daily basis. We've even increased our inspection rates. It's just that we need the community to assist us on this, because tuck shops are mushrooming each and every day. Yeah. So as long as they know there is a new tuck shop that came up, so they need to inform the department, then the team can be able to go out and assist with inspections.
Yeah, I see in your statement you're emphasizing the surge of the number of food poisoning, but you're also, as a department, calling on parents and caregivers to exercise extreme caution. So what is your suggestion when it comes to managing food safety? What advice are you giving to parents at this point?
What we are requesting the parents, we always say go back to the basics. Parents need to encourage kids to prepare lunchbox at home. Because the reason why they go out to buy Zimba chips or whatever outside is because they do not have a lunchbox at home. So a healthy lunchbox plays a crucial role in a child's development. So we are also asking the Department of Education to work with us on training the food vendors that are selling inside the school premises and also outside the school premises. Even though some of them have been trained, but we are trying to reinforce the information. And we always say we are not going to win this battle alone, but we need partnership from everybody. So it is all our responsibility. Unfortunately, the kids that have passed on, we have lost a lot of lives, but we are working on awarenesses that are happening.
I like the fact that you say it's a partnership. It's not on the Department of Health alone, and some other people might be looking at this saying that the partnership should go further than just that, because the other issue that I suppose is the underlying cause of this is the cost of living crisis.
Yes.
Where people have got to look for alternative sources of protein, alternative sources of other products which are sensitive in terms of the cold chain handling of it, and if it's not handled properly, that could lead to chemical poisoning.
Yes. And we are also asking each and everybody to wash hands, because you might find a good product from the shelf, but the fact that there might be any source of contamination at home or while during preparation is also very, very important. So hand washing is one of the crucial things that we are doing, and we are requesting, as we are engaging with the Department of Education and the community, we are promoting hand washing with soap and water.
Yeah. So this, of course, is the latest report now. What are we to expect, I suppose, in the next 6 months as far as those numbers are concerned? 207 food poisoning cases, which, of course, has raised the alarm. Where would those numbers go now in the next 6 months if we are to say the program that you're implementing is effective and the people are responding to it?
So maybe just to highlight that these numbers are the numbers that have been recorded. We do not know how many people have been sick.
Yeah.
So with the awarenesses with the numbers that we have for now, we are hoping that the numbers might be a bit stable with the awarenesses, and at the same time, we cannot really control it for now, because we are also encouraging the community to report in any health facility around. Our healthcare facilities are ready, and getting these numbers, because not everybody will, when he's sick, is able to go to the health facility. So we are just pleading with the community to report, but we will see and we'll be able to observe and monitor the progress. For now, it's difficult for us to say in the next 6 months, this is where we are looking at, but we are hoping that the deaths are going to be reduced.
Yeah, Christina, appreciate your time. Thanks so much for coming on. Christina Moumakwe, Deputy Director, Environmental Health, the head of the Gauteng Food and Safety Forum. The question still for you: what is weakening our food safety and stronger food systems? Your views, 072 110 5584.